Welcome back, Straight Talkers. Depersonalization derealization disorder is characterized by persistent and recurrent feelings of being detached from oneself or one's surroundings. It's estimated that around half of all adults have experienced at least one lifetime episode when evaluating for depersonalization derealization disorder. There are 5 different signs and symptoms that we psychiatrists look for, and these are listed from A to E in the DSM-5. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. Criterion A states that there needs to be the presence of persistent or recurrent experiences of depersonalization, derealization, or both. Depersonalization is defined as experiences of unreality, detachment, or being an outside observer with respects to one's thoughts, feelings, sensations, body, or actions. When patients describe depersonalization, they'll often talk about episodes that consist of perceptual alterations, distorted sense of time, unreal or absent self, and emotional or physical numbing. And an individual might feel detached from their entire being, making statements such as, "I'm no one," or "I have no self." Derealization, on the other hand, is defined as experiences of unreality or detachment with respect to one's surroundings. So when describing these episodes, patients will talk about individuals or objects being experienced as unreal, dreamlike, foggy, or lifeless. Some things might even be visually distorted. Some people say that they're in a bubble, or they feel like they're living life with a glass wall between themselves and the world around them. Others will say the world is colorless, lifeless, blurred. Visual fields might be widened or narrowed, 2D or 3D, and objects might be larger and smaller in size than they actually are. Outside of visual disturbances, some might also describe sounds being distorted as well. So some people will say that various sounds or voices are muted or heightened. Criterion B states that during depersonalization or derealization, reality testing remains intact. And what this means is that during an episode, the patient knows that what they're experiencing is not right and their perception of reality is off. And this is different from those with true psychosis, where patients with this cannot distinguish between what is real and what is not. Criterion C notes that symptoms cause clinically significant distress or impairment in one's social, occupational, or other important areas of functioning. Criterion D states that the disturbance is not attributable to the physiological effects of a substance, such as drugs, alcohol, or prescription medications, or due to another medical condition, such as a seizure disorder. Criterion E notes that the disturbance is not better explained by another mental disorder. The mean age of onset is 16 years old, with less than 20% of individuals experiencing onset after 20 years old, and 5% after the age of 25 years old. And because of this, if symptoms start after the age of 40, it's recommended that underlying medical conditions, such as brain lesions, seizures, and sleep apnea be ruled out. Now head on over to the next video to find out more ways that you can live your best life.